thank you guys for coming. I'm going to be talking about a career in physical therapy today. And this is just what will be discussed, the different work tasks, school, job demands, that kind of stuff. We'll go over all of that. So this is just an overview of a day-to-day physical therapy job. So you're basically just helping people recover from different injuries or surgeries, chronic pains that they may have. And you're creating individualized plans to fit each person. So it could include stretching, strength training, and then you're going to be tracking their progress from different tests and seeing how they're going along in their exercise plan. So the tasks, the daily tasks, this is pretty much it. So if you meet a patient for the first time, you're going to assess them and kind of decide what the best plan of treatment is for them. You're going to be creating that plan, that individualized treatment plan for them to fit each need, whether it be for a knee replacement or just back pain or whatever it may be. You're going to take notes and paperwork and make sure that you're recording all their progress. See if anything needs to be changed or fixed or if it's working really well. And then a lot of times you'll get at-home instructions from your physical therapist because if you only go to therapy once or twice a week, you need to keep doing stuff every day to really see progress. So they might just be laid out different instructions and stuff like that for you. And then if you get to a certain point in your career, you might be working with outreach communities or doing research or teaching or seminars, stuff like that. So that might also be included in your day. To get to the point of actually having a career, you need to get an undergrad and then do 3 years of a doctorate physical therapy graduate school. So you're going to be taking a lot of math and science classes. These include like physics, chemistry, pre-calc, and then you're going to be doing a lot of like lab classes, exercise physiology, that kind of stuff, learning about the body. And then when you get to grad school, it's going to be a lot more hands-on, clinic-based stuff and communication, learning how to work with people and communicating with them. And then you're going to have a lot of advanced musculoskeletal classes, learning how muscles work with each other, so you know the best ways to treat people. The job isn't very physically demanding. You might have some patients that need more instructions than others. So you might be squatting or showing them how to do different stuff. But overall, it's not very demanding. You might also have to lift certain patients that may not be able to walk, stuff like that. So it could be demanding in that sense, but most of the time you're just kind of standing there giving them instructions or sitting down taking notes if you don't have a patient. So it's not very bad most of the time. The work environment, if you've ever been to like a hospital clinic, you know it's pretty quiet, so it's usually really laid back. People are kind of just off doing their own thing, working with patients or taking notes or paperwork. The hospital settings might be a little more chaotic because you have to try and get them to do PT. They don't have to. If you're working in a clinic, people are coming in willingly and they want to be at rehab. In a hospital setting might be a little more stressful because they don't have to do PT, so they might be declining you. But it was ranked in the top 10 happiest jobs according to Forbes a couple years ago, so that's good. The employment outlook is really, really good. Anything in healthcare is going to grow just because health overall is declining and people are living longer. So 39% through 2020, which is really, really good. And like I said before, there's a very high job satisfaction with this. And the median wage is almost $80,000, so that's really good as well. The advancement opportunities aren't really great. Like once you're a PT or a PT, you can't really move up. Like if you started in a business, there might be more advancement opportunities and something like that. But with PT, once you're there, you're just kind of there. You might be able to move around different areas. And the only advancement that I could really come up with is that you could go from PT to teaching in a college or community education, stuff like that. So you could consider that advancement, but overall, there's not really a whole lot. So the knowledge I kind of already talked about, but you need to know a lot of things because there's a lot of different patients that might come your way. You need to be very good at problem solving, kind of thinking outside of the box to be able to give each patient the best treatment that they can get. So you could be working with pediatrics 1 minute and the next patient could be a geriatric patient. So there's a lot of different things and you can specialize. You know, some people specialize in sports therapy and only work with sports injuries. But even then, you still have to know all the different sports and all the different injuries to be able to best treat each person. So there's a lot of stuff you need to know about the body And like always, there are certifications you can get, seminars you can go to, because healthcare is ever changing, so you need to keep up with all the different things that are going on. So I kind of already talked about this, the 7 years of education, you need to get a doctorate now of physical therapy, so that's usually 36 months of of grad school, and there's a lot of different stuff that you go through, so learn about the body, learn about communication, how to work with people, how to make exercise plans for people, all that stuff comes with undergrad and grad school. It's just a lot more interactive in graduate school. And then your clinicals are going to be at the end of your graduate program, obviously. It's going to be very hands-on. You're going to be actually working with people, so you're basically going to be the physical therapist at that point, so you get that experience working with someone who has done it for many years. At the undergraduate level, you're shadowing people to see kind of what goes on, different settings, clinics, hospitals, that kind of stuff. So there's a lot of different things that go into preparing you to be a physical therapist. When you're getting hired, they're more looking at what you've done in your graduate school. They're really looking at your personality, knowing that you can be empathetic and relate to people, that you can communicate with people. People are coming to you and they're in pain, so they look to you to make sure that you're being empathetic and care for them, that you want to make them better. So when they're hiring you, they really look at that. They also really look at what you did in your clinicals, and they reference those people that you worked with in all those different settings. So it's very important to make good referrals through that. And that's where they really can see if you're empathetic and compassionate, because you actually worked in those settings with those people, and they can tell the people that you're hiring or with that you did a really good job with people. So that's very important when it comes to actually getting a job. Obviously, you need the education, but if you're interviewing with someone, you obviously have that, or you wouldn't have the interview. So this job, if you're want to be in the therapy field, you're obviously going to be interested in the body, how it works, muscles, and rehab. You're going to be interested in helping people and making them better. You're going to be empathetic. You're obviously going to be interested in healthcare. Ever-changing, everything's always newer and better and changing, so those are obviously going to be the main interests that you're going to have. There's a ton of job openings, like it says right there. There's over 500 just in the Minneapolis area on one job search engine. So it's definitely not a shortage of jobs. You can go to almost any site and find a job almost anywhere that you look. So it's really good. After doing all the research for this, I obviously want to still pursue it. Something that I am very passionate about, and the job outlook is good, and the job satisfaction is good, so those are both good when looking for a career. So the main things I learned from this is that there's a ton of job openings, so I don't have to really worry about that once I get there. And I was kind of worried about being kind of bored with it after a while, because it's just PT. But there is different settings, hospitals, clinic, you can do in-home services for people. And then there's different areas of study, so you can specialize in different areas and go from one thing to the next, so there is a lot of variety. And I think that's it, so thank you guys.
Thank you.